Yogah Karmasu Kaushalam.
So myself, Satish Pelagade, working with Gujarat Cancer and Research Institute as an associate professor of medical physics. I'm thankful to Professor Jagdish Joshi sir, Director UGC HRDC of Gujarat University, for organizing this refresher course in physics. I'm thankful to the course coordinators, Professor Ian Gajjar sir and Professor M. Hora sir, for giving me this opportunity to interact with the students and the faculties of physics. UGC HRDC of Gujarat University is actively involved in annual refresher programs, and it is a very innovative and established training institute in India. So today the topic of my presentation is application of physics in medicine, and the branch in which this is done is called medical physics. So we are going to see few aspects of medical physics, how the concepts of physics are utilized in medicine for the diagnosis and the treatment of cancer patients. Outline of my presentation includes what medical physics is, what are the responsibilities of medical physicists, what is the certification required to work as a medical physicist in India, how is the work culture, why the radiation is used for treatment of cancer patients, and what are the treatment facilities available at our center. Now, the medical physics, as if you can see in the picture, it's showing a breeze having two pillars. One of the pillar is for physics concepts, and another is the medicine, where the treatment and diagnosis of diseases is taking place. So medical physicist is the person who is working as the bridge between the physics and its application in medicine. So medical physics is the branch of applied physics pursued by the medical physicists that uses physics principles, methods, and techniques in practice and research for the prevention, diagnosis, and treatment of human diseases with a specific goal of improving human health and well-being. Now, this is the person Jean Halley, who is the first medical physicist recognized in the world, and he was the professor of medical physics and hygiene at the School of Health, and then he became the faculty of medicine in Paris from 1795 to 1822. So the medical physics profession is very old, and this is not a new profession, but the scope or the prospects for the medical physics students is excellent in this field. Now, how the medical physics evolved, or what is the origin? Physiological physics flowered in Germany during 19th century, led by the work of Fick. The introduction of the term medical physics into English by Neil Arnott. Neil Arnott was the person who has introduced medical physics terminology in the field, and various contributors are there in this medical physics field profession, starting from Newton, Euler, Bernoulli, Nollet, Madame Curie, Röntgen, and many more noted physicists who has worked in this field. There are many origins of medical physics stemming from the many intersections between physics and medicine. For all the early 19th century, the definition of medical physics was physics applied to the knowledge of the human body, to its preservation and to the cure of its illnesses. And this definition still today holds good. Now, what are the responsibilities of medical physicists? Some of the major responsibilities which I am mentioning over here: establishment and implementation of healthcare technologies. So whatever technology which is having radioactive sources, whether it is X-rays, gamma rays, or radioactive sources, if any technology comes into the healthcare field, it is established, or it need to be properly implemented into the field of healthcare, whether it is for patient diagnosis or whether it is for therapeutic purpose, treatment purposes. It need to be established by the medical physicist. And supervision of radiation protection and safety program. Medical physicist is involved in radiation protection. He has the responsibility of taking care of radiation safety, whether the equipment is safely driven by the technologist uh, and safely operated or safely used by the doctors. That need to be checked by the medical physicist. Measurement of radiation, how much radiation dose is delivered during the diagnosis procedure, or how much dose is delivered during the therapeutic application treatment, that is measured by the medical physicist. Establishment, implementation, and supervision of quality assurance program. There are various quality assurance programs for almost all the radiation generating equipments. It varies from daily quality assurance, weekly, monthly, and annual quality assurance programs. These need to be performed by the medical physicist, and the record need to be kept in the department. And whenever the supervision team from ARB comes for inspection, that time we need to reproduce those values or the reports to them. Optimization of physical aspects of diagnostic and therapeutic procedures. Optimization means whenever we are using the radiation are dangerous to the human health. So there is always a risk benefit. Risk is also there, and the benefit to the patient is also there. So there should be some optimization kind of thing, whether the procedure is diagnostic type of procedure or it is therapeutic type of procedure. The balance need to be taken care by the medical physicist. Then whenever any equipment, newly purchased equipment comes into the department, that an equipment needs to be commissioned, and it is need to be uh, uh, supervised. If the delivery of the dose is very complex or the implementation technique is complex, then that time a medical physicist will supervise such complex delivery technique, and the commissioning of the new equipment is also done by the medical physicist. Now the technical specifications of the equipment and design of installation. So the various type of diagnostic or the therapeutic equipments are available in the market, but the physicist is actually involved in making the technical specification, what type of equipment the institute or the physician which he wants to treat the patient, what type of energies are required, that is taken care by the medical physicist. And even the design of the installation is taken care by, or the plan is done by the medical physicist in the institute. Acceptance commissioning of the equipment is performed by the medical physicist. Technical supervision of maintenance, whether the engineers are doing routine maintenance of the equipment on proper time or not, that is supervised by the medical physicist. Medical physicists are also involved in teaching, research, publishing various research papers in national and international conferences. And so these are the responsibilities of medical physicists in the field of medical physics. And this is about, sorry, certification. So there is a College of Medical Physicists of India, in Atomic Research Center, Mumbai, who used to give certification, professional certification to work as a independently work as a medical physicist in that particular branch. So this is that. Then where the medical physicist can work, medical physicist can work in radiotherapy department where the treatment of cancer patient is done by delivering a very high radiation dose to the patient. Then the nuclear medicine department where the iodine therapy, various radioactive sources are used. Fluorine 18 is used in the PET CT scanner. So there also the medical physicist is required. And then diagnostic department to perform the quality assurance checks to maintain the output and to perform various safety programs in the department. Medical physicist is required. Health physics department, this is a research department in government departments. Then application specialist manager with multinational companies. These are the opportunities in various companies or in private sector, which are manufacturing the diagnostic as well as therapeutic equipments. What actually the aim of radiation therapy is? The aim of radiation therapy is to deliver a precisely measured dose of radiation to a defined tumor volume with as minimal damage as possible to surrounding healthy tissue, resulting in eradication of the tumor, high quality of life, and prolongation of survival at competitive cost. So our main intention is to kill the cancerous cells by sparing the normal tissues, healthy tissues around that tumor. So this is the aim, and this aim we are achieving with the help of radiation therapy. And how the radiation therapy, what is the history of radiation therapy, as you can have a look at it. So in 1895, Röntgen discovers X-rays. After that, in 1896, Becquerel discovers the radioactivity. 1898, Madame Curie discovers radium, and in late 1890s, therapeutic use means the use of radioactive sources or the X-rays started using for the treatment of cancer in late 1890s. In 1920s, reliable X-ray tubes having high kVs, 150 to 300 kV volt X-ray energies are generated, and those used for the therapeutic use. Then in 1950s, cobalt unis was invented in Canada, and it has millions of volt energy. Then in 1960s, linear accelerators ranging from 4 to 25 MV energies was manufactured and started using in the field of radiation oncology or radiation therapy. Then computers and CT scanners came into 1970s. Then three-dimensional, that is called 3D radiotherapy, using the multi-leaf collimator started using 1980s, 1990s, three-dimensional conformal therapy, and from 2002, IMRT, it is called the latest technique, intensity modulated radiotherapy started using. Then after that, image guided radiotherapy. So this is the progress of radiation therapy in a nutshell. So what is the radiation therapy, and who is involved in the team of radiation? The radiation therapy is not a job of one person, like in case of surgeon, he to recovers completely. So all credit goes to one person, but radiation therapy and the delivery of radiation therapy treatment is not a job of single person. It has got a team. So the team includes radiation oncologist, medical physicist, dosimetrist, technologist, radiotherapy, nursing staff, and other employees are also there. clerical staff and tunes and all. So the main job of radiation oncologist is to prescribe the radiation dose depending upon the stage of the tumor or the size of the tumor or uh, other factors are there on which the dose is dependent, and it is decided by the radiation oncologist. And the radiation oncologist is the doctor. He is having the degree of medical profession, MD or DND in radiation oncology. Then second person comes medical physicist. As I told you, what are his responsibilities? And he is also independently working in the field for treatment planning, radiation safety, and commissioning of the equipment. So all kind of things are taken care by the medical physicist. And then there is a dosimetrist who is to help the medical physicist to measure the uh, doses or do the quality assurance checks on the equipment. Technologists are there to treat the patient on the equipment, and radiotherapy nurses are there to take care of all the patients in the radiation therapy team. Now, this is in short, simple comparison of the energy emitted from the radiation. As you know, the electromagnetic radiation, X-rays or the gamma rays, they are the electromagnetic radiations or photons. So it's little bit providing us the comparison for simple light bulb. If you consider it, it has the voltage of 110 to 240 volt. You can get the light from such bulbs. Then diagnostic X-ray tube 80 to 140 kilovolt X-rays can be generated. Lightning bolt means during the rainy season we are getting the lightning bolt 3 to 120 million volts. And this telecobalt machine is 1.1 megavolt energy. And the linear accelerators are available in various low energies from 4 to 6 MV and high energy above 15, 18 MV linears are called high energy linear accelerators. Now, as you know, the person who has invented X-rays, Wilhelm Conrad Röntgen, was a professor of experimental physics from Würzburg University, Germany, and he has discovered X-rays on 8 November 1895 and awarded the first Nobel Prize for Physics in 1901. So after the discovery of X-rays, its application also immediately started. Field is the Anthony Henry Becquerel, the first person to conclude that atoms could be radioactive. 1896, when uranium salts were placed near a photographic plate covered with opaque paper, the plate was discovered to be fogged. And this French physicist, Nobel laureate, and discoverer of radioactivity, along with Marie Curie and Pierre Curie, won the Nobel Prize collectively in 1903 in physics. Then Marie Curie, she is the first person honored with 2 Nobel Prizes in physics as well as in chemistry. In 1903, she has got the Nobel Prize in physics with her husband Perry and Becquerel. And in 1911, she has got the second Nobel Prize chemistry for her work on radium and radium extraction of radium and radium components from various ores. And she was the Polish physicist in 1898, and she has named the emissions from uranium radioactivity and discovered chemical elements, radium, polonium. These are she has discovered. She has worked with cloud chambers and magnetic fields to bend the radiation. She has uh, these are her contributions in the field of radiation or radiation physics or medical physics. So Emil Gruppe, he is the first radiation oncologist He was the medical student in Chicago, and he convinced his professor to allow him to irradiate the cancer patient named Rose Lee. And he has observed that the Lee has got benefit from the extra treatment. So he was the first radiation oncologist or the doctor or the person who has treated actually the patient. Now, why the radiation is used for cancer treatment? Now, for that, we need to understand some concepts like tumor lethal dose and treatment tumor lethal dose. So this is the dose or the radiation dose. Dose means the radiation dose, and lethal means to kill the tumorous cells. So minimum dose required to kill the tumorous cell, that is called tumor lethal dose. So malignant tissues happens to be more sensitive to radiation than the normal tissues, making radiotherapy a practical possibility. So whenever the tumorous cells are there or the malignant tissues are there in our body, then there will be two type of cells. One is the normal tissues, which are healthy tissues, and another will be the malignant tissues, which are fast growing tissues. And if you compare the response of radiation to these two cells, then the malignant tissues observed to be more sensitive to radiation than the normal tissues, and this makes the radiotherapy practically possible. And the radiation given in sufficient quantity can cause total destruction of living cells. Radiation in general harmful to the body. The dose should be minimum required to produce the lethal effect in tumor volume. Such a dose is called tumor lethal dose. So the dose, minimum dose required to kill the malignant tissues of tumor is the tumor lethal dose. Now, second terminology is tumor, tumor lethal dose is that dose of radiation which produces complete and permanent destruction of tumor in vivo. Means inside the body only we are completely irradiating the tissues and completely removing, completely destroying those cancerous cells with the help of radiation. And this tumor lethal dose, in short, it is called TLD for a particular type of tumor chosen as that dose which is lethal to 80 to 90% of tumor cells. So when we are delivering the tumor lethal dose, it is the minimum dose, and that dose need to kill at least 80 to 90% of the malignant tissues inside the body. Tumor lethal dose depends on the nature of the species, then its size, and overall time for whether we are fractionating the dose or single fraction, those kind of treatment protocol. It depends on the dose rate, how the dose is delivered, acquired radio resistance. If the malignant tissues or the tumor has got radio resistance, then also its dose will vary, and the type of radiation, what type of radiation we are using, whether it is X-rays, gamma rays, or any proton particle, carbon particle. So it depends on the type of radiation. Our second terminology is tissue tolerance dose, that is called TTD. And this tissue tolerance dose is the dose below which the normal tissue damage may be considered negligible. So this tumor tissue tolerance dose is for normal cells, which are not malignant cells or not cancerous cells. Okay, so in the following figure, you can see here two curves are there. Along the x-axis, dose is there, and along the y-axis, the percentage of lethal dose goes on increasing. So these two curves are independent curves. For example, one is for tumor and another is for skin. Skin is considered as a critical organ. So if you compare the response, tumor is highly responsive than the skin, and so this is the representation of between the tumor tissue tolerance dose, TLD and TTD. The effect of fractionation on radiation therapy means the radiation therapy dose is sometimes given in a single fraction, sometimes 3 fractions, sometimes 5 fractions, sometimes 30 fractions. So the radiation dose is getting fractionated, and what is the effect of fractionation, dose fractionation on radiation therapy? So in the graph, it is showing surviving fractions versus the doses or the fractions, number of fractions. So first figure is it is showing the course is too long, means we are delivering a number of fractions. For example, single fraction is considered as 2 gray. Normally 2 gray in 30 fractions, so total dose of 60 gray is delivered to most of the tumors. So 2 gray is the single fraction for first day. Then again second day 2 gray of dose is delivered, third gray, fourth gray, like this up to 30 fractions. The 2 gray of dose each day will be delivered. So this is the permanent damage of the normal tissue. So if the course of treatment is too long, then there will be a permanent damage of the normal cells. Means normal cells means the cells which are healthy cells, which are not cancerous cells. So if the course of treatment is long, then the normal tissues will die permanently. Okay. Now, if the course too short, tumorous cells will recover. So B figure is there, so which is showing that, and there is a recovery line, and above recovery line it is going extending. Means the dotted line is for a normal tissue progress, and continuous line is for tumor cells. So both the lines are directing in upward direction, means the tumor cells are getting recovered. Our main intention of radiation therapy is that the normal tissues or the normal cells should get recovered, whereas all the cancerous cell or the 80 to 90% cancerous cell must get die due to the radiation. And the C figure is the optimum treatment, where the tumorous cells die and normal cells recover. In figure C, you can see the continuous line or the tumor cells line is going below recovery line, and the normal tissues are uh, uh, recovering. The dotted line is going in upward direction. This indicates that the tumor or the target or the cancerous cells are completely killed, and the patient has got cured. My size of tumor, dose required to produce the lethal damage for any one tumor species increases with tumor volume. So smaller the tumor, the dose required will be less. If the tumor goes on increasing, the dose will also increase. And limitation, there is one can exceed the dose to the tumor, but we have to keep in mind the normal tissue tolerances or various critical organs which are very near to the tumor. Time factors, there are single dose methods, skin epithelioma. In such cases, a single dose is sufficient to cure the patient. Most of the times, multiple dose method is used. Continuous dose method is also used, and it depends upon the acquired radio resistance of the tumor. Now, this TLD and TTD will give us some therapeutic ratio. Ratio of this therapeutic ratio is defined as the ratio of tissue tolerance dose to a tumor lethal dose. And the lower the tumor lethal dose, more efficient radiation therapy will be. And higher tissue tolerance dose, the better it is for treatment. Curative therapy or radiation therapy, in this case, the response of tumor is expected. Full use of our therapeutic ratio, accurate methods of treatment planning, patient setup, beam direction. Treatment once failed increases the chances of second radiotherapy. Palliative therapy is to deliver the patient of distracting symptoms such as pain, discharge, hemorrhage, and loss of appetite. In this case, the palliative therapy is given, and it provides the prolongation of life in a symptom-free condition. Is the sole objective of this palliative therapy. This is the slide which is showing how the radiation therapy is evolved. In 1960, only the rectangular or square fields treatment was given. Later on, various cerebrum blocking materials or electron blocking materials was used. And after that, in 1980s, multi-leaf collimator was used for the for shaping the target or the tumor. And after that, a computerized treatment planning system in 1990, and after 2002 and onwards, or 2000 onwards, the intensity modulated radiation therapy was considered for as the latest modality for the treatment. And this is the radiation therapy workflow, how the patient comes in the department and what are the different stages, and how we are planning and how finally the treatment is delivered. So initially the diagnosis of the patient and staging, in which stage the patient is there, is done by consulting with the radiation oncologist or the physician. And once this staging and diagnosis and everything is done, the simulation was done with the help of CT scanner, or the conventional simulators are available in the department, which decides the position, patient position, and it takes the images for the planning purpose. When the planning is done by the medical physicist, and he is designing the treatment plan with the help of computerized treatment planning system, and the treatment delivery was done on the linear accelerator, and finally the treatment was executed. And during the subsequent after the subsequent after some time, the response was assessed. The response of radiation therapy to the patient was assessed by the doctors. So basically, this is the workflow. So safe and efficient treatment. So first stage is the simulation, where this immobilization device and this is the CT scanner, where the patient images are taken along with this immobilization device. So this simulation process involves the immobilization for patient positioning and reproducibility, localization to establish system in relation to a reference point or isocenter, modeling 2D or 3D model of patient constructed through imaging. So this is the physicist work is to perform the CT scanner quality assurance, Hounsfield field HU versus electron density table measurements, immobilization device assessment, where the technologist or the person who has made the immobilization device, the net light structures just to immobilize the skull, It's called immobilization device, and whether it is properly fixed or there is certain air gap between the skin and the cast that need to be assessed by the medical process. So this is all about the simulation, which is the important step in the treatment. And the planning is done by the medical physicist, which is who is having the treatment planning system. You can see in this picture that the red color area is the tumor, and in various directions the dose is delivered, and by sparing the lung and other nearby critical organs. So in the process, target and clinical structures were delineated by the physician or the radiation oncologist, and the dose is also decided by the radiation oncologist, and dose limits, and uh, there is the standard international protocols which defines or which informs us or which provides us the information of various critical organ doses, how much critical organ dose is acceptable for particular critical organ, and establish the field portals, calculation of doses, and all kind of things are done by the treatment planning system, who is and all this work is done by the medical physicist. Medical physicist machine modeling when the commissioning of the treatment planning system. Various dose algorithms are used in the treatment planning system. Their analysis, whether they are reporting the correct dose or not, those kind of things. Image registration, visibility of treatment is taken care by the medical physicist. Also, then that treatment means the execution of the uh, whatever we have planned on the treatment planning system. And the whole plan will be shifted to the control console of the delivery equipment, linear accelerator, where the technologist will use that plan for the treatment of patients. So technologists will be there on each equipment who will operate that equipment, and the dose is delivered to the patient. So during treatment process, setup of patient, the patient will be set on the couch, and localization of the ISO center. The ISO center is the point, it's the imaginary point of the equipment, which is fixed at 100 centimeter from the source of generating the X-rays, and it is the imaginary point uh, which is generated by rotating the collimator axis, gantry axis, and couch rotation axis. The central axis of these rotations will the point at which all these three central axis meets. That point is called isocenter, and the delivery of the treatment is will be delivered. Safety checks, there will be various safety checks which will decide the right position of the patient, site. There is exact plan which is prepared by the computerized treatment planning system, and there are various interlocks which provides the equipment functionality, safety, and finally, if everything is uh, considered, setup is okay and everything is good, then the clearance is done, and the treatment is delivered. So the role of physicist here is to do the machine quality assurance and calibration of the equipment, fidelity of treatment process, implementation of new technologies, whatever there in the field, then the workflow efficiency. All these things decided by the medical physicist. Now, there are various treatment facilities available at our center. Actually, there are two types of units. One is teletherapy unit, and brachytherapy unit. Teletherapy unit is the unit where the radioactive source or the source of X-ray generator or the electron generator that will be outside the body. So such units are called as teletherapy. Tele means distance, means it is outside the patient body. And the equipments are Bhavatron 2, which is having the cobalt 60 radioactive source, and there are certain few linear accelerators. Variant DBX model, it has got 6 MV X-rays. Electra compact model, it has got 6 MV X-rays. So 6 MV X-rays are mostly used for the treatment of patient, and high, because this energy is sufficient to treat almost all patients, because the depth of, if higher the energy, if the tumor is seated is at quite inside the body, means thickness of the body is more, in that case the high energy X-rays are used. Before that 15 MV X-rays are used, but most of the treatment is delivered with 6 MV. It is sufficient to deliver all kind of treatments, intensity modulation, radiotherapy, IGRT, and all kind of latest treatment techniques that can be performed along with the accelerators. So these are the accelerators. Variant 2B, this is the latest linear accelerator, which has got the facilities of treating the all sites can be treated with the help of this true beam equipment. It has got the imaging modality also, which is used for setting up the patient before the treatment starts. In the tomotherapy, this is also a linear accelerator, but the treatment delivery is and I say the unit looks like a CT scanner, and the treatment is delivered slice by slice. And this is the technology is very advanced, and this is the latest equipment, and this is we are having. Now, this CyberKnife Accure is the vendor or the company who is providing this equipment, and this CyberKnife equipment is used to deliver a very high dose to the tumor, and mostly up to 6 centimeter tumors can be treated, but small size tumors can be treated with this equipment, and very high dose can be will be delivered through this equipment, and it gives a very accurate dose delivery, and it provides a good kind of treatment. And this is the CyberKnife is the equipment which is available first of its kind in our institute, and none of the government hospital in India, this unit is not available with them. So we are quite lucky to have these equipment, so many equipments at our center. And another side is the brachytherapy units. Brachy is near, and in this case, the therapy is done with the help of radioactive sources, and radioactive source will enter inside the body. As we know, body has got various cavities, cervix, and various rectum, and esophageal cancer. So where the body cavities are there, ear, and there, this brachytherapy treatment is quite useful, and the radioactive source used in this case is iridium 192 and cobalt 60 sources. HDR equipments are also available. So these are the equipments which are used for the treatment of cancer and field. So as a summary, I already given you some history of radiation therapy, how the radiation therapy evolved. Radiation therapy is not a new branch. It's a very old branch, but nowadays, as the technology progresses in the field, it is getting noticed by the society also. Earlier, very few radiation therapy centers were available in India, Gujarat, or everywhere. But nowadays, each and every town has got radiation therapy center. So there is a tremendous requirement of radiation oncologist, medical physicist, and technologist in the field. Then medical physicist responsibilities, we have seen how the medical physicist works in the hospital, and most of the uh, persons think that a medical physicist is the profession where he used to treat the patient, but it's not like that. For the treatment purpose, for treating the patient, technologists are there. They are trained for that purpose only. Medical physicist job is completely or totally different. He's basically involved in, apart from clinical work, he's involved in research, publishing papers, and attending conferences and doing research work. So medical physicist position is the scientific position, and I already discussed the various responsibilities of medical physicist, and we have already seen the how the radiotherapy workflow is there. Uh, who is involved in the team of radiation therapy? What is the role of radiation oncology? What is the role of medical physicist? What is the role of radiation technologies? Those kind of things. How the patient comes in the department? How it is the workflow is there? What is happening? What is simulation? How the planning is done? And how the treatment is delivered, all kind of things we have seen. And we have seen why the radiation is used for cancer treatment. So as it has been observed that through some research that the radiation is more sensitive to the cancerous or the malignant tissues than the normal tissues. And that is why the radiation is used. And we have seen various doses, therapeutic ratios, and how the radiation therapy will be considered for the treatment of cancer. Now, the various treatment facilities available at our center, that also we have highlighted. We have the daily cobalt unit, as well as where the cobalt 60 source is used for the treatment. And we have the number of linear accelerators which are used for the treatment, along with the HDR equipments. So this is in short, I have provided the basic things which are done, which are there in the institute who is treating the cancer patients, and how the medical physicist is working there. And I hope if I'm getting the next lecture opportunity, I would like to emphasize on what are the different equipments, how it works in the field, those kind of things, how the delivery of the treatment is done, all kind of things will be covered in the next lectures. Now, here are certain organizations. All the organizations are the international organization, American Association of Physicists in Medicine. This is the association who takes care of the medical physics applications in medicine in America, USA, and they are providing various task groups which helps the other countries or the physicist who is working in this field. And this is very powerful organization across the world. And then there is a commission on accreditation of medical education program. This is organization which is in Canada. This provides the accreditation to the medical physicist who wants to work in medical physics profession. Then there is an international organization for medical physics, then International Atomic Energy Agency. You might be knowing about this, IAEA. Then American Society for Therapeutic Radiology and Oncology is one of the organization which is publishing various kind of research work, therapeutic research work in the radiation oncology. And then European Society for Radiotherapy and Oncology is another organization which is actively involved in all these activities. So thank you so much for listening to me.